Hi, I'm Robin Teller-Hickey. I'm the owner of Rebalance Pilates, and today we're going to switch up our video format a little bit. The first three videos, we really focused on stretching and strengthening and mobilizing the tissue of the affected arm post-surgery. So as that tissue starts to get tighter, we're slowly stretching it to get our range of movement back. Today, we're going to focus on the lower half of the body, specifically if you have had a TRAM FLAP reconstruction. So a TRAM FLAP reconstruction is the most common of reconstructive surgeries after breast cancer. Essentially what happens is we have this six-pack ab muscle that runs down the front of the body, the transverse rectus abdominis, clinical name. What they do with a TRAM FLAP reconstruction is they take the skin, the fat, the blood vessels, and the muscle from the lower half of those six-pack abs, and they remove it and replace it to create a breast mound. They can do this two different ways. They either remove it entirely and replace it on the breast, or they will tunnel that tissue up under the skin and then create the breast mound from there. So this is clearly pretty major surgery. The recovery time is a good 2 months before you can really start to do any form of strengthening of the lower body. Again, check in with your doctor for that okay before you start to do any form of programming. Now, because we're cutting into your abdominals, posture is going to be affected because the abdominals are part of the system that help keep our torso up. And similarly to the incision site under the arm, the incision site might feel really tender, tight as that scar tissue begins to build, and we become very protective of it. So we may start to round over it to protect ourselves from discomfort. But we want to get back to standing tall. So one of the areas that Pilates really excels in is postural awareness and addressing the rebuilding of those deep abdominal muscles. So as you can probably sense already, this video is going to be very information heavy, and we are going to look at exercises, but we're going to do that in the next video. But it's really important to understand the anatomy and the function of how this system works, so that way we're getting the most efficient and effective use of engagement in that area, so that when you're ready to start rebuilding, we are really hitting it on all cylinders and in the best way possible. So when I talk about the core, I like to call it my house, and I explain it to my clients like it's a house. So I start with the floor, the foundation, which is my pelvic floor. It has floor in its name. It's the foundation of my house, and it lives at the base of my pelvis. So you can think of like when you're putting on a pair of pantyhose and you've got that diamond at the crotch, where that comes in contact with you when you pull your pantyhose up, that's where the pelvic floor lives. And so it lives from our pubic bone to our tailbone and our two sit bones. And I like to think of it like a clock face. So 12 o'clock is my pubic bone, 6 o'clock is my tailbone at the back, and then 3 and 9 o'clock are the two little sit bones on either side of my pelvis. So that is the foundation of my house. Then I have the walls, and the walls are the abdominals, the deepest of all of them, the transversus abdominis, which wraps around the whole torso like a corset. You've got the internal and the external obliques, and then you've got your six-pack abs running down the front. There's also these little muscles in your back called multifidi that attach onto the vertebrae, and I like to think of that like the chimney going up the house. And then finally, the roof of the house, which is the diaphragm. Now, I spoke in the first video about the importance of the breath and diaphragm, that diaphragmatic breathing, as a pump to help flow that lymph fluid throughout the body. The breath and the diaphragm become very important when we're looking at the lower half of the body as well, because the pelvic floor and the diaphragm mimic each other in movement. So when we take a breath in and we draw that diaphragm down and it spreads and widens, bringing the air in, the pelvic floor is also spreading and widening. I'm not bearing down. I'm not trying to push anything out, but I want to image it just widening like a sunflower opening, or you can think of that clock face again, but the numbers are spreading wide apart from each other. On my exhale, as that air is being pushed out, the pelvic floor is also pulling in and up. So we often on exhale push down, but we actually want to pull up on the exhale. So the way that I do this with my clients is I have them place their hands in a little triangle, thumbs under the belly button, the fingers towards the pubic bone, and taking just a breath in and imaging that opening of pelvic floor, clock face widening. And on the exhale, feel the clock face drawing together. Inhaling here and exhaling. And I want to feel the pubic bone, the tailbone, and the sit bones pulling toward each other on that exhale. On the inhale, I want to imagine they're widening apart. And on the exhale, I want them to pull together. So you may have felt a spillover into the abdominals while you did that. So there is a direct connection between the engagement of the pelvic floor and the engagement of the abdominals. So that's why we want that pelvic floor to be strong and connective, because if it's not working properly and the pelvic floor starts to sink, well, what happens to the foundation of a house if it's not properly supportive? Everything else starts to kind of sink and fall apart. So we want to make sure our foundation is strong. When we've cut through part of the abdominal tissue, whether it's a C-section or the TRAM FLAP reconstruction, that area can become numb and it's hard to feel those muscles engage. So that's why I like to access a re-engaging and strengthening that tissue through the foundation, through the pelvic floor, because of that, the way that it all connects together. So the breath and the pelvic floor become really important in that work. So once we have that breath down, in the next video, we're going to start to go through some gentle exercises that you can do that's going to start to wake that tissue up again, using that pelvic floor to help support that system. Thanks so much.